Pain on either side of your belly, so either here or here during pregnancy, is usually round ligament pain. This pain can get worse during the end of the day. Sometimes you might even just wake up with it. Here are 3 things that you absolutely want to start to do if you have pain on either side of your belly. Okay, the first thing we're gonna do is anytime you go from a sitting position to a standing position, sometimes that might feel like that pain is being aggravated. What's happening is that the round ligament is simply just uncrunching itself after sitting. It might get worse after longer periods and stints of sitting. So one thing you absolutely need to do is, especially as your belly gets bigger, when you're sitting, you want to lift your belly up physically with your hands. So you're going to cup. You can bring your hands together, clasp them together, or simply cup them. Or if your belly's too big for that, just come either side of the belly and just lift up towards your head. You continue to lift up, and then you exhale as you're lifting up. That's going to help slack the round ligament, give it a little bit of support, and that's going to help you manage some of that round ligament pain. So if you're having pain on that side of the belly during the pregnancy, that is the very first thing you need to start to implement. The second thing you should do is start to stretch your hip flexors. So I like to do this in a supported fashion. Okay, this could be your kitchen countertop to help get you a nice stretch on the front of your hip. You're just simply supporting here, bringing this leg back, keeping the belly pulled in kind of tight, like you're using your abdominal muscles. And then you're in this split stance. So it looks like this, okay? The weight is equal on your front foot and on your back foot, and you're tucking your tailbone underneath your body to open up the front of that hip. And I like this supported, and you don't have to feel it much. It can just be a really gentle stretch. You're gonna hold this 30 to 60 seconds. You'll slowly come out of it. You can give yourself a nice compression on the front of your pelvis and help pull baby up as you bring that leg in. And then you're gonna simply switch sides. Same thing, pushing this hip forward, tucking your tailbone a little bit to intensify the hip flexor stretch. Holding it, this should not cause any pain at all. Then you can simply lift belly up, lift baby up, and help that foot come back. If that's too much, then just stay planted on your kitchen counter and then bring the leg forward. And that is gonna help you open up your hip flexors. The round ligament and the hip flexors are all in the same area and in the same plane. So helping doing some stretching on them during the day is really, really nice way to help give that round ligament a little bit more extensibility, decreasing some of the pain signals that round ligament can send off. A lot of times the pain from the round ligament comes when that ligament just becomes so taut and tight. So those are just some good considerations to do. One more stretch that I like to do for round ligament pain is actually to do an adductor or an inner thigh stretch. I find this stretch super effective in helping open up the inner thighs, open up the pelvic floor. So this is the stretch, and this is what it will look like. You're here supported on the countertop, and then you're taking your butt cheek and turning your butt to the opposite back wall. As you hold this position, you should feel it on your inner thigh. So on the opposite thigh of the butt cheek, going to the opposite back wall, you should feel it. So if you're going to your left cheek is to the back wall, then you should feel it on the inner right thigh. You're gonna switch sides, tilting the pelvis. You don't really need to bend the knee. This should not hurt the knee. The more you keep your knees kind of a little bit straight, but not hyperextended, you'll feel it more up towards the pubic bone. Here's what it looks like from the back. You're here. I'm stretching my inner right thigh, right on this side here. And then I would switch sides. Holding 30 to 60 seconds. And back and forth. And you could do that 3 or 4 times. You can do that throughout the day, whatever it takes to help free up that round ligament pain. A little bonus tip is at the end of the day, always spend at least 5 minutes doing some diaphragmatic breathing, some opening breaths. This is not only going to prepare your pelvic floor and your diaphragm for birth, but this is also going to help just lubricate everything in the belly, giving that round ligament a little bit of release and relaxation. So what that looks like is you can lay on your side or be seated, have a hand on the belly, have a hand on your chest, and then just take some nice deep breaths into the hand on the belly. Inhaling, pulling all the air down, exhaling and letting it leave your body. As you inhale, you imagine the pelvic floor opening. Exhale and let it go. Inhale and open. Exhale and let it go. Here's what it looks like from the side. Inhale and open. Exhale and let it go. So you're just letting that belly distend, you're letting the air fill the rib cage, and you're thinking about that pelvic floor descending and opening. I'm Dr. Allison Feldt. Like and subscribe to this video, share with your friends who are pregnant or who are experiencing round ligament pain.